It is January 11th. It has been 1 week and 1 day since chemotherapy. The week was horrible. There's just no other way to describe it. It was absolutely horrible. I couldn't eat. I was able to get fluids down off and on. I was able to eat on Monday a little bit. Constant nausea. Like systematic bone pain off and on. Constant headache. I can't even just go over all the symptoms. It's just everything from the constant metal taste in your mouth to like muscle jerks, just everything. It was just, I have never been so miserable in my entire life. And I almost died in a third world country from giardia. It wasn't even, it was worse than that. I have never been so ill in my life. It's horrible. The day after chemotherapy, I went in and got more medication and fluids. Helped a little bit, took the edge off. I was able to eat a little bit after that. 3 days later, I was back in again. More medication, more fluids. Was really not doing great. Was doing a little better. Can't remember what day it was. Day before yesterday. And then yesterday was a bad day. It was just a really bad day. I just woke up, everything hurt. I was sick. I couldn't eat. Couldn't even hardly get fluids down. It was just a bad day. But I had a checkup that day with my oncologist. She went over my numbers, took a good look at, weighed me. I had lost 10 pounds in the last 7-8 days. My white count was at 0. And she thought maybe I had an infection. So she was very concerned. She sent me back down to the treatment center for more fluids, more medication, intravenous, antibiotic, and Adequine. It's like a sedative, but I guess it helps with nausea too, so it just kind of helps you sleep, calms you down, gets the nausea under control so you can eat again. My mom came up for the day, so it was really wonderful to have her here, because that was a really rough day, and it was just really nice to have her here. I got to see my dad for a little bit too, so that was nice too. Talking with the oncologist, she decided that this chemo is really aggressive. I'm getting 2 different drugs, and they're very aggressive, and she's decided it was too much for me for that first round. So my next treatment is scheduled for the 24th, and they are going to lighten it, a little bit lower dose, because it completely wiped me out. It just completely took me out. It was horrible. I am much, much better today. I've been able to eat. I was back in today for more fluids and some more intravenous medication. But feeling a lot stronger. I have an appetite today. I'm not jittery. I don't have any pain today, so that's good. Probably don't look great. But, you know, what can you do? So the plan is to continue with treatment every 21 days. They're going to lighten my dose a little bit, so the next one doesn't completely wipe me out. I'm supposed to go in for fluids and, you know, intravenous nausea control kind of medication periodically as, you know, as the symptoms build and get worse again. She says that she thinks I'm out of the dark part yet now. She said it shouldn't get that bad again. So right now there are 3 more of these scheduled. Next one's on the 24th. She's promised me they will be lighter, so. And we're keeping it at 21 days. She says that she doesn't think I'm going to be able to tolerate it any more frequently than that. So I'm thankful for that as well, because I'm just today I'm starting to feel like I'm going to live through this. I meant to make more of these while I was in the clinic, and okay, it just didn't happen. It just didn't happen. So next time. But today, yes, is much better. I'm eating, drinking fluids, spirits are back up, feeling a little stronger. I was able to actually do some house cleaning today, so that was awesome. Yeah, I guess that's all I really have right now. Trying to think if there's anything else that would be pertinent or interesting at all. I've just met a lot of people, which has been interesting. Like yesterday when I got my blood drawn, they keep having this ongoing issue with my port not wanting to work, which has been a pain. So somebody will, hook me up, and they can't get blood, in or fluid in or blood out, and so they'll have me lay on my side and lay on my back and cough and breathe deep and put my hands up and wave my arms around, and it's become kind of comical. Every time I go in, we have this issue, and I have to do this dance, and it takes 3 different nurses trying, and pretty soon, finally, somebody will get it to work. But one of the nurses I met yesterday that was fighting with this thing, because I guess it's tilted, so, and they think it might be sitting next to a valve or something, so she was fighting with it and asking me, questions about, kind of cancer I have, where I'm at on my treatment, what's the prognosis, how long, what drugs I'm taking, how long I guess she had the same, almost the exact same diagnosis and treatment 2 years ago, so it was just kind of cool to talk to her about how, she got through it and things that helped her. And it's funny, the more people I talk to, the more people keep pushing the weed thing. It's weird. Now I've got nurses and, medical staff that are like, are you sure you don't, it's just funny. But, so I have not resorted to that as of yet, but I don't know if I have another week like I did last week, I may resort to it if it comes to that again, so. But it hasn't been necessary, or I don't know, maybe it would have been necessary this week. I don't know. It just didn't. It wasn't on my mind. So, but yeah, I've met a lot of people at the hospital and work at the hospital who's been through this, and it's interesting to hear all their different, perspectives, little tricks that they learned, things they did to help them get through certain days or certain symptoms and how they coped with it. And how long their treatment lasted and how they responded, just things like that. It's just kind of, it's nice to talk to people that are on the other end of it, so I can project out and say, I'm going to be there when, at some point, it's going to be a while, but, so, this chemo is going to go for 6 months, is what it's looking like. I'm hoping not quite that long, though, because when I met with the, when I met with the oncologist, she did another exam, and the tumors actually changed in consistency already. And she said, we usually don't see any change in the first week, so good news, bad news, you're really sensitive to medication. The chemo's really super effective, though, so it's already making a difference. So that's the good part. So maybe I won't have to do 6 months of this. Something. I will do 6 months of it, though, if it means I don't have to do radiation, so there's that. They still are talking, of course, of radiation because the tumor is so big and because it's affecting lymph nodes. Because I had, had started moving into stage 3, they really want to do radiation, but I'm still really not willing to do that, so that means all chemo, 6 months, fine, I'll do it. There's no radiation, I'm not doing it. So yeah, that's where we are. I don't know if there's any questions or anything anybody'd like to see or anything, I guess let me know. My brain's not always in gear, and there's a lot of things that I'm not remembering or thinking of lately, so let me know, I guess. Yeah, more pending.